6:06 this morning, doctors sounding the alarm on a really concerning crisis happening side by side with the pandemic.
All new this morning, 41 Action News reporter Dan Cohen takes an in-depth look at an issue affecting more and more people, even younger people, as we approach a year living with COVID-19.
Alcoholic liver disease was already trending in the wrong direction in the United States before the pandemic.
I'd say over the last 5 to 10 years, the incidence of alcohol cirrhosis has increased, as well as the age we're seeing it at. We listed a 20-something-year-old just a couple of weeks ago for transplant.
Then came stay-at-home orders and what doctors call an available coping mechanism.
I know a guy who owns a liquor store, and he said his rate of liquor sale in the months after the shutdown in March and April, he sold enough booze in those 6 weeks that made up for his whole last year's worth of sales.
Taken together, the pandemic and an already concerning increase in alcoholic liver disease have created an adjacent health crisis. Doctors have seen a dramatic increase in cases since last March.
From 10 transfers, maybe 8 or 9 are alcohol serious disease. So it is incredibly evident that this is a problem. So, I mean, it's a more than 100% increase in cases.
Doctors are also noticing demographic shifts in the patients they're treating.
What we're really seeing, which is most concerning, is seeing this in younger and younger patients that are coming through. So these would be healthy people that think that alcohol is relatively safe or they can't get into trouble with alcohol.
All 3 doctors we spoke to say they're seeing patients in their late 20s and early 30s, more female patients, and severe outcomes.
Damage that alcohol can do to the liver can be quite significant. So it can range from just very mild increase in blood tests that could be ordered by your doctor to all the way to seeing damage on a cellular level that can end up leading to signs of end-stage disease.
Doctors say damaged livers lead to an increase in transplants, an area affected deeply by the pandemic.
It has implications as to how to consult our patients who needs to be vaccinated, when patients are on the transplant list, how to manage that, what time is the right time to transplant them, how to test for COVID-19 right before the transplant, not only for our recipients, but on the donors.
Local health leaders are seeing the intertwined effects of the pandemic and alcohol use firsthand.
I did see a person who lost their job from the pandemic and was spending time at home and turned to alcohol for coping mechanisms, and within 9 months of the pandemic had gone from a purely normal functional person to now needing a liver transplant.
As for COVID-19 itself and the vulnerability of the liver, doctors say that is also lethal.
We have learned from recent publication that patients with chronic liver disease are 3 times more likely to die from COVID-19 as a complication as it relates to having underlying liver disease and the COVID-19.
A comorbidity that comes with a singular message from the medical community: drink responsibly.
We want people to understand that, yes, alcohol has been used safely by people. It can also be a source of severe damage.
Doctors are also worried about an increase in the incidence of fatty liver disease as a result of sedentary lifestyles. The organ is critical for metabolism, and with sitting at home, sitting in front of your screen, they're worried about folks having that as well. Taylor and Lindsay, they say that the effects of the pandemic on the liver with these diseases will be felt for years to come.
That's such a frightening thought. So, Dan, what did doctors say about warning signs for liver disease, as well as something I think a lot of people are sitting here wondering, guidance about the number of drinks that are considered safe or at least not harmful to be consuming?
Yeah, we definitely want to get those guidelines out, and doctors do as well. With warning signs, jaundice and inflammation, those are the 2 big ones. As for those CDC guidelines on excessive drinking, they say that for women, 4 drinks or more in a single setting is excessive. For men, 5 drinks or more in a single setting is excessive as well. And again, this isn't one of those things where if you drink, you're going to get liver disease. It's a matter of excessive drinking, multiple times per week. And what Dr. Ryan Taylor told us is that even if you're drinking 2 per day, that adds up to more than 14 in a week, and that puts you at a risk for liver disease as well. And when you hear about the age of these patients as well, the thought of being in your 20s and needing a liver transplant, it is definitely scary.
I think the sedentary lifestyle bit with the fatty liver disease, too, is I think a lot of people are worried about maybe, oh, I might gain some weight during pandemic because I'm not doing as much. But it could be really doing harm to your insides more than you're aware of if you're not paying attention to that and watching for those signs. Dan Cohen reporting live for us this morning at the University of Kansas Medical Center. Dan.